Hello, welcome to our channel, Life with Ben. Today, we're going to go over some MRI and radiologist results that we received last night. I've been waiting impatiently to see these images of Ben's brain for the last couple of days. He had an MRI um, Wednesday afternoon to check the status of the brain tumor, what Ben likes to call the bad guy, and the cyst that is with the brain tumor. Ben is fighting a pielocystic astrocytoma. It's between grade 1 and grade 2, so it's a slower growing tumor. It's not as aggressive, but the problem with the tumor in Ben's brain is it's in a very sensitive location called the brainstem. And if you don't know much about the brainstem basically is the area in the brain that just controls your breathing, your heart rate, um, every vital organ in your body that keeps you alive. That's what the brainstem does. And the tumor in Ben's brain is right up against the brainstem, the left temporal lobe side. So, a little backstory, real quick, before we proceed. We first discovered the brain tumor when he was 1.5 years old from seizures. We had an MRI done, and the tumor was about 2 inches by 2 inches in his left temporal lobe, which it's kind of right over here. They went in to do the surgery. They got probably about 70% out. After the surgery, they sent it into, for a biopsy. About 2 weeks later, we get the biopsy and the pathology results back, and we were told that it was not cancer. Thank God, hallelujah, that they were calling it cortical dysplasia and that he did not have cancer, and it was not an astrocytoma like they previously thought from the scans. He did some follow-up MRIs that we were told verbally nothing had changed, everything looked good. And the purpose of this video for me and showing you these intimate pictures and reports is to protect and to help other moms and dads in similar situations. Ben was misdiagnosed. The pathology and the biopsy that was done when he was a baby was wrong. And we did not realize that until the tumor grew back 3 years later when he turned 5. And the one mistake that Jesse and I, my husband and I, made were trusting these doctors, honestly. We're trusting what they said. We're trusting the results. We're not looking deeper into it. And most importantly, not reading the radiology report and the results. And back then, this was in 2017, technology has grown leaps and bounds. And, now we have my charts where things are uploaded, our results are uploaded, our images. And now we can see and we can read and we can look and we can dig and we can scrutinize everything. And it's right at our fingertips. We did not have that back in 2017. We basically just went off the words of our doctors, and they were wrong. And after the tumor grew back for Ben, when he was 5, I started digging and looking for the radiology reports back when he was a baby. And what I found was really disturbing. The 1 year post-op radiology report mentions that mentions a cyst and that it's just more predominant. And they never told us. They never told us a cyst had been created after the surgery. And if I would have had my hands on that radiology report that they should have given me, I would have demanded and requested follow-up MRIs every year. And I didn't, because they told me he didn't have cancer. They told me he would not need yearly MRIs because it wasn't a tumor and his brain looked normal. But it wasn't. And that was a mistake that I made. So as a mom and dad, if you're sitting here and you're watching this and you're finding out that your child has cancer, read the radiology reports, look at the scans. In today's technology, it's so easy. There's no excuse not to. So I wanted to show Ben scans with you and what the radiology reports look like, and how I figure out things now so that I can better advocate for Ben and his future treatments and what's happening in his life, because the medical system has burned us time and time again. And at the end of the day, they're practicing medicine. At the end of the day, we are the ones picking up the pieces of things that go wrong when they go wrong, not if, when, because they do. It happens. And if you've never been burned by a hospital and by doctors and by the medical field, consider yourself lucky, but we have time and time again. So what I'm going to do before I show Ben's latest MRI results, I want to show everybody what it looked like after the second brain surgery in 2021, at its worst, when it was growing, when it was, the cyst was out of control, before we started any sort of treatments. So there we go. Okay, for this October one, Astrocytoma. What is this? So this is what I do. If I don't know what I'm looking at, I will copy the word, come over here and paste it. What is that? Rare, slow-growing brain tumors that develop from cell. Okay. All right. Interesting. So this is the first time I've seen this word. So that's basically what's telling you why they are doing the MRI. And then down here shows findings. So findings, let's see, enhancing a soft tissue mass in midbrains and pons. That's basically the brainstem, which is stable compared to prior. So remember what I said about the 4 millimeter difference? Yes, it'd been growing the entire time, but very, very slowly, but they still called it stable. The associated cystic component enlarged when compared, so it keeps on growing the cyst. The cyst is now 2.7 by 3.5 centimeters, which is about, all right, so that's how you read. Like I said, if you don't know something, just copy and paste. All right, so let's look at it. Let's Ben's beautiful brain from the side. So all these images, all these images. So we're gonna go to this one. Is this one right? Yep. So I'm gonna start it right here. So these are all these are photos, but as you click on each photo and you do it fast, it shows the images of the brain. So there's the tumor right there. This is right here, the brainstem. So we're going to go deeper. There's the tumor, and that is a cyst. inside of the brainstem. Right here is fluid. This is the surgery. This is where this used to be brain tissue. Now it's just filled with fluid from the surgery. So basically, Ben does not have a left temporal lobe. See how cystic it is? There's like a little cyst inside the tumor. And then as I keep on going, so it looks like here's the cyst. The cyst is basically sitting on top of the tumor. So the tumor has produced this cyst right here. And it also has produced this gigantic bubble that's pushing everything over to the side. So this is when they wanted to do surgery. Insert a straw into the cyst, call it an Omira, and leave it in there. So this is what this looks like right before we started chemo and cannabis. All right. So that MRI scan was when it was 6 months after the surgery, and the tumor itself had grown again, and the cyst had grown from, because they drained it during the surgery. So the cyst had grown from about 15 millimeters to now, 40 millimeters. I think that's what it turned out to be. Around this time after the scan, we chatted with our team, our neurology and oncology and surgical team, and they wanted to start Ben on chemo. That was a hard time for us because we didn't want to put poison in his veins. And at that time, we were trying other holistic things that obviously were not working. We were told by his oncology and his neurosurgeon that he would need surgery almost immediately to drain the cyst. The cyst was growing out of control. Ben was showing signs of having, it says this increased cystic component results in increased mass effect on the third ventricle with new trace hydrocephalus. His head was starting to tilt and his eye was going wonky, and it had a lot to do with that gigantic cyst in his brain and the tumor, of course, pushing on his brainstem. So they recommended surgery. Of course, I personally did not want them to cut him again because when he had surgery 6 months, before and earlier in the year, he had a stroke. And so I was not really trusting that option, but our team was telling us that chemo will not shrink the cyst. They've never seen any chemo shrink a cyst. And we were told that surgery would be the only option. And I was very adamant on, we're going to try the chemo first before you cut my kid again. And so that's what we did. And right after the scan in December, we started Ben on chemo. Thank God our insurance approved the inhibitor chemo instead of the injection. The inhibitor chemo is more a targeted therapy and has less side effects, but there are side effects. There are heart risks, eye risks, among other things, and it's a newer drug, so there's not a lot of history with this particular chemo, but it looked safer than the injectable chemo where they have to put in a port and he has to go in, weekly. So we started him on that inhibitor chemo, but at the exact same time I started him on cannabis as well. I found a wonderful lady who has an organic cannabis farm, and I started giving Ben her plant every day, and we started the two together. So let's go ahead and check out the next MRI results. Let's do about 3 months. We'll check it out 3 months on the chemo and the cannabis. Now, mind you, they told us the cyst will not shrink. And they also told us the chemo inhibitor is it builds in the bloodstream. So it takes a while to see results from this inhibitor to do anything with the cyst or the tumor. We were also told that Ben had about a 30% chance of shrinkage. He had a 30% chance of it being stable and not doing anything. And they had a 30% chance of it growing and the chemo not helping at all. So those were our options. And we were also told that Ben at this time would be on chemo most of his childhood. That we would be on the chemo for 2 years, we would take a break, and then put him back on once it started growing again, and then take a break. And this would be his childhood. So let's look at the scans coming up. 3 months. 3 months after starting him on cannabis and the inhibitor. All right, let's see what it looks like. Indication, pleocystic, okay, neoplastic brain, yep. Comparison, 522. Okay, that's all right. Let's see. So at this time, Ben has been on the chemo and the cannabis for roughly 4 months. So it says changes underlining nodular enhancement along the brain stem. So they're saying it's now 2.2 by 1 by 1.2 centimeters for the actual tumor part. And it's basically shrunk a little bit. But the cyst, which was 3.5 by 2.8 centimeter, has shrunk by 2.7. So let's see. Cystic has decreased compared to prior exam. All right, so let's take a look. 4 months on cannabis and chemo together. Ben's brain. So this is Ben's brain. I'm going through it. There it is. There's the tumor. Wow. The cyst inside the brainstem is significantly smaller. The tumor itself does not look as cystic and bright. And there's the cyst. Noticeably smaller. That's 4 months on chemo and cannabis. So I remember the scan. The doctor came in and had, our oncologist is the best. I trust him. Out of everybody that I've worked with all these years of fighting cancer, he's a good person. He listens to us. He doesn't push. Anyway, he came in with the biggest smile on his face, and I knew he had good scans. And he just said, Ben's tumor is responding so remarkably to the chemo. And I said, well, what about the cannabis? And he was like, well, I don't really believe in that, but let's just go from here. It's okay if he takes it. I don't believe it's that. So that was really exciting. And I just had this sudden just feeling of relief lifted because the cyst wasn't growing. And it was shrinking incredibly just after 3 months. It was just amazing. I mean, wow. So cool. All right, so let's go to, so that's April. Let's go to September. Let's go to 7 months on chemo and cannabis and see what it looks like. Okay. Indication, encounter for therapeutic drug level monitoring. That's the chemo. All right, that looks fine. Post-surgical changes, yes. Decreased nodular enhancement along the left midbrain and pons, now measuring 19 by 6 millimeters. Previously, 19 by 9 millimeters. So it's shrunk a hair. Oh, also cyst has decreased from, so it was 27 by 24 millimeters, now 15 by 16. Holy moly. All right, let's check this out. This is 7 to 8 months on chemo and cannabis. Let's find the image. The tumor. So as I'm getting in deeper, that's so it looks like. It looks still shrinking from the last one, the hair, not by much. But look at that cyst. Look at that. Wow. That's incredible. This is, again, where they cut him. This most likely is where he's having seizures from where they cut him. So that's what it looks like. 7 months on chemo and cannabis. Cyst. This. All right. So everything is decreasing again. And 6 months on cannabis and chemo. I remember speaking to the neurosurgeon about this. And I asked him, because he was very adamant that we were going to be back in his office discussing surgical options for the cyst. I remember asking for him to call me after seeing this report. And I asked him, I said, I so remember this conversation so vividly. I said, what do you think about these radiology reports and the scans? I'll never forget his first word, remarkable. It's just remarkable. And I asked him, I said, have you ever seen this chemo inhibitor shrink a cyst? And he said in his 20 plus years of neurosurgery that he's never seen a cyst shrink like this on any pharmaceutical. And that when the cysts grow to this magnitude, surgical intervention is always needed. Even suggesting that putting in an MRI into the brain, basically a straw into the cyst, is what he was planning on doing with Ben, because he knew the cyst would keep growing back. So instead of cutting into his skull and into his brain every time the cyst grew, the MRI is just kind of like a plug. You just stick a needle in the skull and you drain the cyst. That's what his plans were with Ben. And it was completely unnecessary, because putting Ben on the chemo and the cannabis shrunk it. So it just leaves me believing that there are so many people doing unnecessary surgical things that medicine and holistic medicine like cannabis can treat, because the cyst and the tumor has responded beautifully to the cannabis and the chemo combination. So there you have it. So let's go ahead and check out the next scans. So January 4th, 2023, after about a year on chemo, because we actually stopped the chemo in December of 22, but his scans were January of 23. We decided to completely stop the chemo because of side effects that I read other children having on this particular medicine, and I honestly did not think it was the chemo killing the tumor and shrinking the cyst. I thought it was the cannabis, and I wanted to put my theory to test. So instead of him being on the chemo for 2 years, like we had discussed with his doctors, they were okay with us stopping it since the tumor was shrinking, with anticipation from the doctors that we were going to just put him back on it after the next scan, because we were told that he would need treatment to keep the tumor stable. And the whole cyst thing is just a big question mark, because the chemo was never supposed to shrink the cyst. They were just appeasing us to try, and it did. I know the cannabis shrunk the cyst, and I'm going to tell you why here in a little bit. But yes, so we stopped the chemo. He still had a chunk of active tumor on his brainstem when we stopped it. And the scan that I'm about to show you is what it looked like when we stopped the chemo altogether. January scans. The cyst is 1.6 by 1.2. It says it's unchanged, which I believe that because it doesn't look smaller. Enhancement, which is the tissue, the brain tumor part, along left mid-pons, is similar to recent. So that's saying that's stable too. So let's look, just have comparison on what it looks like. There's the cyst. Let me find, I think this is the image. There we go. All right. So this is what it looks like after stopping. So we just stopped chemo. This is what it looks like. We're doing cannabis and we are doing garlic twice a day at this point. Yeah, so it's very, very much still lighting up, still cystic. You can still see a little thickness and cystic marks in it. It's still there. It's smaller, a lot smaller, like 80% smaller. And like I said, when we stopped this, the oncologists were very, very clear, do not be surprised by the next scan if this grows. And our oncologist is really, really optimistic. So he wasn't being a doom and gloom. He was trying to prepare us so we didn't freak out. And it was just all about preparedness. And I appreciated that. But so let's look at 3 months later, see what that next scan looks like, and let's see if it grew. So that was January of 2023 is when we stopped chemo. Next scan was May, saying everything is stable. Overall size of cystic and enhancing components are stable. Unchanged nodular enhancement. All right, awesome. It's saying it's unchanged. They told us it would balloon up, most likely. Let's look at it. Our cells. All these images, out of all of these images, we can only see the tumor in one. I think it's this one. Yep, there it is. There it is. 3 months, 3 or 4 months after stopping chemo. They told us it was going to balloon back. It didn't. In fact, I feel like it looks even smaller. There's the cyst. Nothing has changed. Well, this is cannabis and propolis. Sorry. This is getting all mixed up. This is cannabis and garlic only. All right. Let's check out. Nothing's grown. By this scan, Ben was taking cannabis, and I had also added raw garlic to our daily medicine routine. I called it his natural chemo. So if you cut up garlic, it has to be raw, 1 clove of garlic. You cut it up, you let it sit for 15 minutes. You chop it, like dice it, let it sit for 15 minutes. It develops and creates a enzyme called allicin. And studies from a South Carolina university has shown that this enzyme that the garlic produces when it's injured, basically, that it kills glio cancer cells. And astrocytoma is a glio cancer. So that's why I started giving him the raw garlic. So I gave him the raw garlic twice a day with the cannabis. And that's what I stayed on. So everything looks good. They were surprised nothing has grown back, and the cyst has not grown back. So we're still on the every 3 month scans. So let's go ahead and look at the next scans. So the next scans are, so around this time in May, between the 2 scans, we added something new to the cannabis and the garlic, something called bee propolis. Bee propolis is basically the glue or resin that holds beehives together. You can scrape it off, and most beekeepers throw them away, but they have so many, bee propolis has so many antibacterial, antifungal, antiviral properties in it, but also has anti-cancer properties in it that we found out from this beekeeper we met in our state. And he started giving us bee propolis. He scraped it, and we gave it to Ben twice a day with his garlic. So Ben is eating raw garlic with applesauce. I add applesauce in it so it goes down better, and bee propolis and cannabis. That's his natural chemo that now he has been on for, this is May, for 5 months. And let's check out what the tumor is doing. This is where we are at. Everything looks good. Let's check out the scans. So this is 9 months off of chemo, 9 months off of chemo, and just taking garlic, propolis, and cannabis. Look at that. There it is. And there that is. And all along, the doctors in the radiology report is telling us it's stable. That is not stable. That is dying. Off chemo. That's stable. That hasn't changed. That's not. That's a dying tumor. I don't know about you, but I see a significant difference from last scan. Significant in this tumor, and yet they are still saying it's stable. No, it's shrinking. It's shrinking off chemo. It's just an incredible feeling as a mom to see these results and to go back through them with you and to talk to you about them. Chemo. He was on chemo for 10, 11 months. But this tumor is continuing to shrink and die without chemo, without him being on it. And now at this point, he is taking every day garlic, propolis, and cannabis. That's our natural chemo. That is what we're doing to kill this boy. The radiologists are saying it's stable. I'm going to tell you something about radiology reports. When it mentions stable, they have a wiggle room of about 5 millimeters, 4 to 5 millimeters that they work with. So if the tumor has grown 4 millimeters, they will say it's stable. If it shrunk 4 millimeters, they will say it's stable. So just keep that in mind if you're being told it's stable and you read the radiology report and it says stable, but when you look at the scan, it's like, oh, that looks like it might be a hair bigger, or that might be a hair smaller. It probably is. And go with your gut, like read it, look at it, scrutinize it. That's our jobs as parents, to protect our kids. And I have learned that that's my responsibility, not the doctor's. I will take what they say, and then I will do what I want with it, up to a degree. And let's go to today's scan. Let's see what it looks like today. Shall we? Drum roll, please. Okay. With temporal lobe. Unspecified convulsions. Okay. Thalamic, basal ganglion. That's where the tumor was located. These areas in the brain. Thalamic, basal ganglia, and medial temporal lobe, which is his left temporal lobe. Stable, smooth enhancement overlying the resection cavity, likely reactive. What is this? I don't even know. So when I don't know what a word is, reactive, when I think of reactive, I think of it's growing. It's becoming active again. Oh my God, what are we going to do? Let's figure out what the terminology is. MRI, reactive brain tumor. What does that mean? What is it? What does reactive mean? It says, in the context of brain tumors, reactive refers to changes that the tumor causes in the surrounding brain tissue. Huh. This is not even the tumor, it's around the tumor. Swelling, scarring, tissue death. These changes can include swelling, scarring. This is the first time I've seen this described in the radiology report. And that's really exciting because Our doctor has told us that what we see is scar tissue, but I haven't seen it in the radiology report, and that is exciting. Let's check out the images. This is from Wednesday. This is 2 days ago. Where are you at? All these images. What is this one? Is this one it? Let's see. So let's go through it. Spin's beautiful brain. All right. There's the brain stem. That's not it. Is this it? Momcology 101. Things we have to do to protect the ones we love. You can see it a little bit, but that's not what I'm looking for. Out of all these scans, it takes me a while to find. There it is. That's the reactive tissue. The swelling, the scarring, it's not even a tumor anymore. It's gone. It's just reactive tissue. Swelling, scarring, tissue death. That's what the radiologist is saying that is. And the seizures are somewhere over here. Thank you very much, surgeon. There's the tumor. Sorry, there's the cyst. This is nothing. There is the cyst. 2.5 years taking daily cannabis, garlic, and propolis. This is how you kill a brain tumor. There it is. That's what's left as of today. And they didn't even say, the radiologist didn't even measure it as a tumor. He said enhancement, likely reactive. That's the first time I've ever seen the radiology report say that. We beat brain cancer. This is phenomenal. We are now 2.5 years off of chemo, off of treatment. He was only on it. We stopped in December, but we started lowering it in November. So when I say 10 to 12 months, that's kind of what I mean. But what you see in these images, they are garlic, propolis, cannabis. That's what we use. And that's what we will continue to use until adulthood. A lot of these, we were told that juvenile pielocystic astrocytomas are primarily a kid disease, and that they tend to shrivel up and die off when he's in his adolescence or as an adult, like in his 20s. And we were told that he would be on and off treatment until then. But he has been off treatment for 2.5 years now, and the oncologist has told us that the likelihood of it not growing back since he's been off treatment for this long is it's very slim. He does not see it happening. And the feeling I have right now, it's such a big win. Cannabis, I don't know if you can see it. This is what we use. Garlic, 1 clove twice a day, so morning and night. And this is propolis. I cut it up. It kind of, I don't know if you can see, but it kind of becomes dusty, but you can dice it up to like a pinch and put it with garlic. So if you know anybody fighting cancer, especially brain cancer, have them try raw garlic twice a day, cannabis, and propolis, and see what happens. Because you may not need Western medicine. You may not. I've seen cases where kids have taken exactly what Ben has taken and their tumors continue to grow. And in that case, absolutely follow your gut and follow the doctor's recommendations. But why not try something else too? Something safer, something from the earth, something from the plants, something holistic. And of course, chat with your doctors about it. Every new thing that we added to Ben's routine, we talked to our oncology team about it. And what I love about my oncologist is, even though he doesn't believe in it, he still supported us. He still was okay with us trying anything. And he still, to this day, believes the chemo is what killed the tumor. But he can't explain why, A, the tumor did not grow back after we stopped the chemo, and B, why the tumor continued to shrivel up and die. The chemo does not do that. It just doesn't. He hasn't seen that happen before. And C, he can't explain how the chemo shrunk the cyst. And even though he has all these questions, he still doesn't believe the plants had anything to do with it. I don't understand that. So there you have it. This is kind of a long video, but I wanted to show you the history of the scans and what they look like. And if you want to continue to follow our medical journey, Ben still battles seizures, and they're recommending now yearly MRIs, but not quite ready for that. So he'll have another MRI in 6 months to continue to check on the reactive tissue. I'm not even going to say tumor anymore. Reactive tissue. That's what's in there. That's what has happened, and that's what the radiologists have said. So we're going to continue to check on the reactive tissue and the little bubble, we call it the bubble, the cyst, that's still in his brain. He's still recovering from the stroke they had from the surgery. And we have a lot more to share with the world. So follow us, and you can see some bigger, better things. And the next step in our battle is figuring out a way to stop the seizures. So thanks for chiming in. You're funny.
Not very many ninjas hiding in this room. It's too small.
Why is this room?